Hi, my name is Jessica Baird, and today I'll be presenting my Extreme Makeover project for Nursing 713, Organizational Systems and Leadership for the Advanced Practice Nurse. As we all know, communication is a key point to being a successful leader, and I look forward to sharing why with you today. This is the table of contents for our presentation today. And the purpose of today's presentation is to examine the impacts that poor communication can have not only on the workplace environment, but on patient care outcomes. The learning objectives for today's presentation are as follows. Identify qualities that facilitate positive communication patterns, discuss how poor communication can hinder patient outcomes and workplace satisfaction, articulate the importance of using one's voice to influence change, examine how different leadership styles can impact situational outcomes, and analyze the importance of evidence-based practice on implementing leadership outcomes. The story I'm choosing to tell you is one about a medication error that occurred due to poor communication. One evening, I was working in charge of a busy CVICU unit. A COVID-positive ECMO patient had just coded. We obtained ROSC, and the provider wanted to do an emergent bronchoscopy at the bedside. As the charge, I was the runner to get medications for the nurse who was in the room with the provider in their full personal protective equipment. The provider requested 1 amp of sodium bicarbonate, which the nurse relayed to me, and I went and got it for her. I handed it to her through the door, and she proceeded to give the medication IV push. The provider then asked for the bicarb, which had already been given, and it was then that it was realized that he had intended to use the medication endotracheally for the bronchoscopy. Although she could tell he was frustrated with her, there was no discussion of what occurred. He simply did the bronch, left the room, and then left the hospital. Days after the incident, the nurse was approached by management with a write-up regarding the error, and she was told the doctor was very upset about what occurred and didn't understand why she did not know that the bicarbonate was to be used for the bronch and not to be given IV. As you can see, this situation was very poorly handled from several different angles and lacked communication regarding verbal medication orders, clarification of route, debrief during or after the situation, and the consideration that personal protective equipment can serve as a large communication barrier. When reflecting on themes that continually come up during conversation with coworkers about the workplace, there are sadly more negative than positive themes reflecting the culture of my organization. Short staffing and lack of support from management come up almost daily, while unsafe patient loads and going to extreme lengths for patients who have little to no hope of a positive outcome weighs heavy on the staff. The staff feels that management has no concern about staff well-being, which leads to discussion about discontent with the environment and other job opportunities that are available elsewhere. This turns the workplace into one that breeds a culture of hopelessness, underappreciation, and staff feeling undervalued and replaceable. The most telling culture is that the staff feels overworked and unsafe in their practice, leading to concern for patient care and massive burnout. Lastly, the staff feels that physicians are unapproachable and fears to ask for clarification and ask questions due to the concern over their responses. These cultures are not sustainable to have a positive working environment. In order for an organization to become successful, they need to reflect on their conversations and how things need to change to produce positive outcomes. According to Davidson et al., an organization cannot thrive without having a stable work environment for staff. The components, which will be discussed further in future slides, are patterns of relating, patterns of meaning, ways of talking, listening, and being, and innovation. If these 4 components are reflected upon, organizations can transition from authoritative leadership styles to a more relational leadership style. This style incorporates collaboration with employees, an approachable leadership effort by management, and in this case, physicians, and a change of language away from a mechanistic approach and towards a more understanding approach. Patterns of relating is the first component of organization as communication. Patterns of relating is defined by Davidson et al. As how people interact with one another and form an organizational culture. In my workplace, interactions are based solely on a chain of command approach. If you have a problem, you must utilize your chain of command rather than approaching whoever is directly involved in your concern. Next, staff feel that physicians are unapproachable, which leads to poor patient outcomes because nurses are afraid to ask for clarification on certain situations. They fear that the physicians will look at them as stupid or incompetent. Management has also developed a culture of mistrust in staff due to their lack of support when issues are brought to their attention. For example, concerns over short staffing and heavy patient assignments have been repeatedly brought up to management, only to be met with flippant responses such as, "It is what it is, we will just have to make do for now." These responses have developed a culture of hopelessness among staff due to poor communication from upper management and doctors. Patterns of meaning, the second component of organization is conversation, are the specific themes that exist in an organization that are usually reflective of their mission, vision, and values. The values of my specific organization are to champion patient-centered care, be an owner, exemplify teamwork and connections, and to embrace the future. These themes are having trouble being upheld by staff for several reasons. First, to champion patient-centered care is a point of contention among nurses because they feel concern about the lengths they are going to save patients who clearly do not have a chance of survival or viable life after their stay. The mention of hospice or palliative care is almost always shut down by physicians. Second, being an owner is difficult for staff because they feel if they accept personal responsibility for an error, they fear for retaliation from management and doctors. Third, to exemplify teamwork and connections is difficult for staff due to the constant turnover and unsafe staffing ratios. It's hard to have teamwork and help each other when you are treading water to stay afloat with your own patient assignment. Lastly, to embrace the future should be coming from a collaborative effort between staff and management to improve processes, but instead staff feels ignored by management. This task makes it seem impossible. Ways of talking, listening, and being are the third component of organizational communication. There are 5 different kinds of listening. Downloading is listening only to confirm personal beliefs, not to learn or explore new viewpoints. Object-focused listening is paying attention to detail and facts that confirm certain or disconfirm certain ways that are done. Empathetic listening is more focused on connecting with the other person and less focused on a personal agenda. And emergent listening is an authentic way of coming into being in a situation, truly being present in that moment and listening from a flow of state or grace. Last, nonverbal cues is a large part of communication. My organization seems to operate solely off of downloading and would benefit from utilizing both empathetic and emergent listening tools to improve communication. Ways of talking stabilize a culture, and each conversation is an opportunity to change. You should choose your language intentionally and use rhetoric, which is the art of using language effectively. The way that staff is talked to by management or physicians greatly influences culture. If staff goes to management with an issue, not only are they met with poor listening skills, but also with responses that make them feel like they are not being heard or being underappreciated. For example, when discussing unsafe staffing ratios, management tells staff that there is nothing they can do about the short staff and someone has to take care of the patients. Mindfulness, or being, is being aware of the way you react or interact in situations can greatly impact the way that leaders are viewed by staff. If management and physicians were more mindful, relationships between them would improve greatly. In order to implement change, the organization should implement complex relational being in the workplace while moving away from right is right, wrong is wrong views. According to Davidson et al., innovation is an important component in organization as communication and has the following components. First, realizing that there is a misunderstanding is the key to implementing innovation. If both parties can realize a misunderstanding occurred, they can both begin to move forward together. The next component is the emergence of dissipative structures of meaning, and the last is the use of both and thinking. The both component is the ability to recognize the importance of having multiple perspectives on situations, and the component that comes from the potential positives and innovations that can come from ongoing conversations. In order to change my organization, I would first begin with changing the patterns of relating. In this sense, there would be an increase in collaborative communication between staff and management and physicians. There would not only be a collaborative conversation, but conversations that reflect honesty and integrity to tell the staff the truth in order to strengthen relationships. There would also be an increased openness to discussion between staff and higher-ups regarding solutions or innovations to problems. Next, patterns of meaning would change by doing a deep dive into why the values of the organization are what they are, and how everyone can work together to uphold these values in a positive way. There would be a shift from a culture of shame to a culture of respect and improvement when a nurse tries to be an owner of their practice, and there would be an improved sense of relatability between staff and providers and management to create a stable work environment. In rewriting my story, the situation would be as follows. In a post-code situation of a COVID-positive ECMO patient, the physician wanted to do a bedside bronchoscopy and requested sodium bicarbonate without any further details. The story could progress one of two ways. The RN could either feel comfortable enough with the communication between her and the provider that she does not fear to ask for clarification of the order due to retaliation from the doctor, or she could not ask for clarification and make the medication error. In this version, she is still going to make the medication error. After the sodium bicarbonate was given IV, the RN immediately notifies the provider. Here, she's being an owner and implementing patterns of meaning. This would be met by the provider immediately discussing the situation with her and discussing where the communication breakdown occurred. This would show having mindfulness of personal error, talking, and being. They would then debrief the situation in a calm manner, showing improved patterns of meaning. Next, management would be brought into the situation by the physician to collaboratively discuss the problem, and the nurse would be brought into the conversation to see, from her standpoint, how this error occurred and how it can be prevented from happening again from all sides. This shows improved innovation. Implementation of all of these tactics would allow all involved to recognize miscommunication, talk about it, learn from it, and develop changes. As you can see, communication is one of the most important things that can be utilized in the workplace. And if organization as communication is implemented, there can be endless possibilities to how great a workplace can be. Thank you for your time today, and please see my references in the next slide.